Hey friends, welcome to a new session on Staff Nurse Exam Preparations by Nurse Winners. Let's see 10 question and answers with rationale in this session. Let's move on to the question. First question. The second heart sound is due to options: aortic valve, B. mitral valve, C. tricuspid valve, D. foramen ovale. The right answer is option A. aortic valve. Rationale: heart sounds are produced from a special event such as closure of a valve and tensing of chordae tendineae. The heart sounds are divided into S1, S2, S3 and S4. S2 sound is produced due to closure of aortic and pulmonic valve to prevent regurgitation of blood into right and left ventricles. The second heart sound of the heart is due to option A, aortic valve. Now let's see the distractors. S1 sound is heard due to closure of mitral and tricuspid valve. Foramen ovale is the opening between right and left atrium. It closes as soon as after birth or within first 6 months of life due to extreme atrial pressure. Second question. The most universally accepted indicator of health status of the whole population is options: A. crude death rate, B. infant mortality rate, C. maternal mortality rate, D. child mortality rate. Answer: option B, infant mortality rate. Rationale: infant mortality rate is one of the most universally accepted indicators of health status, not only for infants but also of the whole population and of socio-economic conditions under which they live. Distractors: crude death rate. The crude death rate is the number of deaths occurring among the population of a given geographical area during a given year per 1000 mid-year total population of the given geographical area during the same year. Maternal mortality rate. It's the number of registered maternal deaths due to birth or pregnancy related complications per 1 lakh registered live births. Child mortality rate. Child mortality rate is typically defined as the number of deaths of children under 5 years of age in a given year per 1000 children in this age group. Presently, it is known as under 5 mortality rate or U5MR. The term child mortality rate is not presently used. Third question. Each beat of human heart is completed in options: A. 8.6 second, B. 8.5 second, C. 0.85 second, D. 5.8 second. Answer: option C, 0.85 second. Rationale: a human heart beats for about 72 times in each minute. Hence, the duration of each beat is 60 divided by 72, which is equal to 0.83 second. 0.485 is nearby value to 0.83. So the right answer is option C, 0.85 second. Fourth question. Pulse pressure of BP 140 by 90 mm of Hg is options: A. 50 mm of Hg, B. 140 mm of Hg, C. 90 mm of Hg, D. none of the above. Right answer is Option A 50 mm of Hg. Let's see the rationale. Pulse pressure is the difference between systolic and the diastolic blood pressure. It represents the force which heart generates each time it contracts and is measured in mm of Hg. In the above question, systolic pressure is 140, diastolic pressure is 90 mm of Hg. So the pulse pressure, it is the difference between systolic and diastolic. So 140 minus 90, it gives an answer 50 mm of Hg. All the other options are incorrect ones. Fifth question, epidemiological triad is options A. Agent host environment, B. Agent vector host, C. Vector carrier environment, D. Agent treatment environment. The right answer is option A. Agent host environment. Rationale: a traditional model of infectious disease causation known as epidemiological triad. The triad consists of an external agent, a host, and an environment in which the host and agent are brought together, causing the disease to occur in the host. Sixth question, the pain medication of choice in acute myocardial infarction is A. Pethidine hydrochloride, B. diclofenac sodium, C. codeine sulfate, D. morphine sulfate. Answer D. morphine sulfate. Rationale: morphine sulfate is the drug of choice for MI due to its reliable and predictable effects, safety profile, and ease of reversibility with naloxone. Distractors: diclofenac sodium is contraindicated in patients with acute MI due to its action of aggravating thrombotic events. Codeine sulfate is an opioid analgesic used for mild to moderate pain. The adverse effect of codeine is that it brings about circulatory depression and respiratory depression, hence cannot be administered in case of acute MI. Pethidine administration causes respiratory depression and hypotension, which thereby affects the cardiac output. Hence, it is contraindicated in acute MI. Seventh question, digoxin is not given when heart is options below 60 beats per minute, below 70 beats per minute, below 80 beats per minute, option D, below 90 beats per minute. Answer option A, below 60 beats per minute. Rationale: digoxin is an anti-arrhythmic and inotropic drug under class of cardiac glycosides. It increases the force of myocardial contractions, prolongs refractory period of AV mode, and delay the conduction through AV and SA node. Thereby, it slows down the heart rate and increases cardiac output. A patient receiving digoxin should be assessed for apical pulse for full 1 minute before drug administration. The drug is withheld in case of heart rate less than 60 beats per minute in adults, 70 beats per minute in children, and 90 beats per minute in infants. Eighth question, following is not the feature of hemorrhagic shock. Options A. hypotension, B. bradycardia, C. rapid and thready pulse, D. thirst sensation. Answer B. bradycardia. Rationale: hemorrhagic shock is caused due to severe blood loss in the body as a result of trauma, surgery, or any other major illness which contribute to blood loss and thereby resulting in decreased blood volume. Because of decreased blood volume, circulatory status get affected and a person land up into hypotension wherein there is decreased blood pressure. Pulse is usually fast in the primary stage and later gets dampened, which results in rapid and steady pulse and not bradycardia. Diminished blood volume enhances thirst sensation. Ninth question. Adequacy of fluid replacement in a patient with shock is best determined by options: A. Systolic pressure above 100 mm of Hg. B. Diastolic pressure above 100 mm of Hg. C. Urine output of 30 ml per hour. D. Urine output of 50 ml per hour. The right answer is option C. Urine output of 30 ml per hour. Rationale. In all patients with shock, urine output is a marker for adequate renal perfusion and cardiac output. Normal urine output in adults is 0.5 ml per kg per hour or equivalent to 30 to 40 ml per hour. One of the classic signs of shock is hypotension. Systolic blood pressure of less than 90 mm of Hg and diastolic pressure of less than 60 mm of Hg is found in patients with shock. Last question. A 48-year-old woman presents to hospital complaining of chest pain, tachycardia and dyspnea. On examination, heart sounds are muffled. Which of the following assessment findings would support a diagnosis of cardiac tamponade? Options: A. Deviated trachea. B. Absent breath sounds to the lower lobes. C. Pulse of 140 with inspiration. D. Blood pressure of 140 by 80 mm of Hg. The right answer is option C. Pulse rate of 140 beats per minute with inspiration. Rationale. Cardiac tamponade is caused due to fluid accumulation in the pericardial sac, which compresses the heart. It results in increased adrenergic tone, which in turn increases systemic venous pressure and heart rate. The increased pressure prevents the heart chambers from collapsing, and increased heart rate preserves the cardiac output. If the accumulation of fluid exceeds about 250 to 300 ml, it causes a condition called as pulsus paradoxus. Hence, the two ventricles compete among each other for space, and any increase in right ventricular volume during inspiration will shift the ventricular septum to left, thereby reducing the venous return and drop in BP, and the opposite during expiration. So the correct option is increased pulse with inspiration. Cardiac tamponade exhibit classic sign called as Beck triad, which includes low blood pressure, increased JVP and distant heart sound. Cardiac tamponade represents a classic sign called as Evort sign or pin sign, wherein there is dullness with bronchial breath sounds, especially below the angle of scapula. There are no absence of breath sounds at lower lobes. Deviated trachea is usually found in conditions such as pneumothorax, which results in unequal intrathoracic pressure. Thank you. Happy learning. Please comment, subscribe, like and press the bell icon for more updates.